Price Fresh Pack presents Heat Illness. Did you know your body is constantly in struggle to disperse the heat it produces? Most of the time you're hardly aware of it, unless your body is exposed to more heat than it can handle. Heat stroke. Heat stroke can occur when the ability to sweat fails and the body temperature rises quickly. The brain and vital organs are effectively cooked as the body temperature rises to a dangerous level in a matter of minutes. Heat stroke is often fatal, and those who do survive may have permanent damage to their organs. Someone experiencing heat stroke will have extremely hot skin, an altered mental state ranging from slight confusion to coma. Seizures can also result. Ridding the body of excess heat is crucial for survival. Please move the person into a half-sitting position in the shade. Call for emergency medical help immediately. If humidity is below 75%, spray the victim with water and fan them vigorously. If humidity is above 75%, apply ice to the neck, armpits, or groin. Do not give aspirin or acetaminophen. Do not give the victim anything to drink. Heat exhaustion versus heat stroke. Heat exhaustion can cause fainting or dizziness, excessive sweating, cool, pale, or clammy skin, nausea or vomiting, rapid, weak pulse, muscle cramps. Get to a cooler, air-conditioned place, drink water if fully conscious, and use cold compresses or cloths. Heat stroke. Throbbing headache, no sweating, body temperature above 103 degrees, nausea or vomiting, rapid, strong pulse, may lose consciousness. Call 911. Heat exhaustion. When the body loses an excessive amount of salt and water, heat exhaustion can set in. People who work outdoors and athletes are particularly susceptible. Symptoms are similar to those of the flu and can include severe thirst, fatigue, headache, nausea, vomiting, and sometimes diarrhea. Other symptoms include profuse sweating, clammy or pale skin, dizziness, rapid pulse, and normal or slightly elevated body temperature. Uncontrolled heat exhaustion can evolve into heat stroke, so make sure to treat the victim quickly. Move them to a shaded or air-conditioned area. Give them water or other cool non-alcoholic beverages and apply wet towels and have them take a cool shower. Heat cramps. Heat cramps are muscle spasms that usually affect the legs or abdomen muscles, often after physical activity. Excessive sweating reduces salt levels in the body, which can result in heat cramps. Workers or athletes with pain or spasms in the abdomen, arms, or legs should not return to work for a few hours. Instead, you should sit or lie down in the shade. Drink cool water or a sports drink. Stretch affected muscles. Seek medical attention if you have heart problems or if the cramps don't get better in an hour. Whether working inside or outside, when it's hot, water is not optional. When we release people for breaks, we need you to take drinks of water, not go outside in the heat and smoke cigarettes. Thirst is the first sign your water reserves need a top-up. If not treated, heat illness can quickly escalate to heat stroke and death. So we will give extra breaks when it is very hot. To avoid heat illness and heat stroke, keep well hydrated with pure water and take regular cool-down breaks. The best way to avoid a heat-related illness is not to limit exposure outdoors during hot days. Air conditioning is the best way to cool off according to the CDC. Also, drink more liquid than you think you need and avoid alcoholic beverages. Also avoid any kind of caffeinated beverages. Wear loose, lightweight clothing and a hat. Replace salt lost from sweating by drinking fruit juice or sports drinks. Avoid spending time outdoors during the hottest part of the day from 11 a.m. to 3 p.m. Wear sunscreen. Sunburn affects the body's ability to cool itself. Pace yourself when you run or otherwise exert your body. Do you have any questions?